Genius is my idea.
It's camera time.
Huh? No, I want. What? Can we do this one first?
Do you have any specific questions?
No, just point out everything.
You guys are supposed to be prepared for these things.
All right. After
I'm
my
prepared, but I
last
just
test,
want
you
to. I just
owe
want to
me-
know.
Hey, you owe me on my last test.
I don't owe you anything.
Yeah,
you owe
because I
me on
started
your
the
last test.
Yeah, I
Showdown.
owe you like 9 questions.
What do you even want me to point out?
Not to this one. Why would we need anything on this?
I don't know. You brought it
Yeah,
over.
take that out of here.
Okay, can we go to
This crazy kid.
the
Oracles.
Wait, hold on. Okay, now Q.
Oracles.
Yes.
Right atria.
Bam.
Right ventricle.
Bam.
Left atria. Left ventricle. Tricuspid valve. Bicuspid valve. Pulmonary semilunar valve. Aortic semilunar valve. Pulmonary trunk.
Okay.
Pulmonary artery. There's another one right there.
Other side.
These are your pulmonary veins.
Okay.
Do we have to know like the stuff on the outside?
What?
Like when you close it, like
Those veins.
what
Veins
these
and
are?
arteries? You need to know some of them.
Alright.
If you bring your books over, I can figure out which ones because I don't remember what's in there.
Anybody want to grab a book?
But
We're all like, we don't want to.
there's some other stuff.
Recording here.
Papillary muscles.
Where? Okay.
Wait, that's the coordinate tendinae, right?
The white is the chordae tendineae. The papillary muscles are what they're attached to.
Okay.
So basically, these flaps of the valve attach to chordae tendineae, which attach to the papillary muscles.
All right.
There's some over here too.
And then what are in there other muscles? What are they called under the papillary ones?
I mean, there's a,
Pectinate, is that what I'm thinking of? Am I thinking of the wrong word?
I don't think your book has anything else that you need to know as far as
Okay,
muscles.
so I'll look at the lecture book because it's got a lot more stuff in it.
Look at your lab book for the lab
All right.
test.
I just don't look at it because it's not filled in and I don't feel like doing it.
I mean, it kind of focuses your study a lot better than
Okay.
the lab book, so I would look at that.
All right.
Okay, what do we need to know from the book?
I don't remember, so
The outer
What about
parts.
the nodes? You gonna have those in essay?
I think the nodes are actually on the model, so I guess they are. So that'd be the SA node,
Okay.
AV node.
Alright, I already know those. Okay, so what next? What's the next model?
The bird.
There you go, my friend.
I have a bladder.
Okay, so ureters, urinary bladder. Got the detrusor muscle,
What's it called?
detrusor muscle. You guys got something I can point with?
Use my finger.
This is the trigone.
Is that line right there? Oh,
It's like
okay, the whole
smooth
little triangle.
See how there's like these rugae
No, you're not
everywhere
pointing.
else?
Where?
The,
like
see how it's rough? It's like
Oh, yeah? Oh, and then where
it
it's
gets
rugged,
smooth
it's
right
rugged.
there.
Yeah.
That smooth part is the trigone. It's triangle. Okay. You got the openings to the ureters,
Okay.
and the internal urethral orifice, and then bordering the internal urethral orifice is going to be your internal urethral sphincter. And then on
That's
this one,
which part is that?
it's the
the
muscle.
line right
It's
there?
the muscle bordering the internal urethral orifice. So
Okay.
the sphincter is basically a muscle that controls an opening.
Yeah.
So it opens or closes and allows fluid to flow.
All right.
And then this is a male. You can tell because
Prostate.
there's the prostate. Right. So this is going to be the prostatic urethra right there. On the back here. Vas deferens.
What are they? Vas deferens?
Vas deferens.
Yeah, I remember hearing that.
Don't remember that.
Seminal vesicle. Right. And the vas deferens and the seminal vesicle come together in the prostate to form the ejaculatory duct, but you can't actually see that on this model.
Alright. Next. Let's go to this
Doing
one.
everything?
Yeah, man.
In.
Did you guys study before coming
Yeah,
in?
yeah.
Yes.
I was looking at all these in the library. I just want to make sure I was remembering
You're
them
supposed
right.
to come in and like ask me actual questions.
Someone said it was actually more helpful.
We're asking
like,
you
have
to go
point
over
at
the
it.
whole thing.
I should have just done this in the labs, actually, when you were doing it.
Yeah?
But you weren't really happy last lab. You were sick.
I
just pay better
always
attention
tell
in
you guys
class.
that if you
We're
want
in
to
a
stay
bad
after.
mood. I did stay after, and you failed me.
You stayed after to take a quiz that you hadn't
She was
taken.
just slacking off.
Okay, did I cheat on it? No.
I don't know, did you?
I got one question right.
Alright. So there's the ejaculatory duct.
Alright.
See it? I'm not going to go over the stuff I already went over.
Alright, fair enough.
You have the scrotum.
What is it again?
Scrotum.
Oh, yeah. I don't know that.
These
Testicle.
nuts.
It's the epididymis.
So what?
Epididymis. This whole thing is the spermatic cord.
Which part? This whole thing right
This
here?
whole thing, I
Alright.
mean, it extends farther. It's kind of cut off, but it's the spermatic cord. Within there, you have the cremaster muscle, some vessels, and also the vas deferens.
Is that stuff we're gonna have to know, like, be able to label? Can we see that on other models?
I mean, basically, this is the spermatic cord, but we could have a question like true or false. This is what's located in there.
Oh, okay. So the cremaster muscle and what else?
The cremaster muscle, there's some vessels, so
Okay.
veins and arteries, and then the vas deferens, okay?
Alright, vast deferens.
Which is that white thing on the back of the bladder that I showed you.
Okay.
Right, that it actually runs through the spermatic cord up around back here. This is part of the vas deferens, right there, and then it comes together with the seminal vesicle to form the ejaculatory duct. All right. We have spongy urethra. There's corpora spongiosum, corpora cavernosum, glans penis is there.
What is it?
Glans penis.
Glands? That's just the head of it?
Yep.
Okay.
The prepuce is the skin, like foreskin essentially. Alright. It's about all the extra stuff you can see on here that you need to know.
Cool. Yeah, I think I'm good on this.